So, Assalamualaikum and good morning to everyone in this holy month of Ramadan. Warm welcome to the 16th online session organized by Adar Health Bangladesh. We also convey special greetings on World Veterinary Day today on 24th April, and the theme was veterinarians' response to the COVID-19 crisis. Again, in this day, we deeply mourn in the loss of Dr. Nurul Amin sir, who was one of the very early appreciators of Adar Bangladesh activities. This is Shubho Singho. I am currently working as a PhD student and also engaged as a research assistant and member of Adar Bangladesh, and will be assist you in today's session. Today, our invited resource person, Dr. Subramaniam Sivaraman sir, who is popular in the name of Dr. Sivaraman, will discuss on abomasal disorders in dairy cows. Abomasal disorders in dairy cows are very important from the clinical perspective because of the involvement of survivability of the productive animals, and the knowledge on the correct diagnosis and management is very crucial for the veterinarians in the field practice. Now, shortly I will introduce to Dr. Sivaraman sir. Although we all know him very well. He had completed his Doctor of Veterinary Medicine degree from Madras Veterinary College in 1995, and subsequently he had completed his master from College of Veterinary and Animal Sciences, Manuthi, Kerala, on clinical veterinary medicine in 1997. In 2010, he joined as an assistant professor at Veterinary College and Research Institute, Namakkal. He further pursued his PhD on clinical evaluation and therapeutic strategies in Downer's cow syndrome. He has published more than 60 articles in national and international scientific journals. He was awarded for setting up the best model veterinary clinics and best veterinarian during his 12 years of practice before he moved into the academia. He has years of experience in handling large animal clinical cases. His major expertise is in veterinary clinical medicine, and his specialized field of expertise is large animal internal medicine. Additionally, he has specializations on large animal ultrasonography, mammary gland ultrasonography, and small ruminant internal medicine. Dr. Sivaraman is very much popular among the field practitioners of India and Bangladesh for his innovative ideas in clinical practices such as development of a specialized movable sling for treating the Downer's cow syndrome, observation and evaluation of ruminal microflora under microscope, very simplified blood transfusion in bovines and small ruminants in field level, and many more diagnostic and clinical tools which are frequently utilized by the veterinarians in the field practice in India. He has supervised many postgraduate and PhD students. So, Adar Health Bangladesh is very much delighted to have Dr. Sivaraman sir in today's session. In this session, we also have several national and international experts as the panelists among us. From the academia, Dr. Rozaihan Mansoor from University Putra, Malaysia, Professor MD Rafiqul Alam, he's yet to come here from Bangladesh Agricultural University. Then Professor Dr. Yusuf Elai Chaudhuri, Chattogram Veterinary Animal Science University, he's also yet to come. And then Dr. MD Farad Hossain, he's the Director Livestock Research Institute, and he's a very popular dairy practitioners and consultant in Bangladesh. And then Dr. MD Shafiqur Rahman, he is now the Deputy Director of Government Poultry Breeding and Development from Joshua, and also a dairy and poultry consultant. So before going into the main session, I request to the audiences, please don't forget to add your valuable questions in the comment section, and please share the program. At this stage, I am cordially requesting to Dr. Sivaraman sir for sharing your presentation. The floor is all yours, sir. Thank you.
Thank you very much.
Yes. So you can open your presentation, sir.
Yeah.
Just this. Thank you, sir. We all see. Yes, sir.
The screen is available, I think.
Yes, sir.
Yes. So good morning, everyone. So I'm very much happy to be associated with the Adult Health Bangladesh 16th online discussion program regarding the abomasal disorders in dairy cows. So first of all, I would like to congratulate the Adult Health Bangladesh team head Dr. Mizan, my friend and colleague Dr. Mizan, who is doing a wonderful job in the Adult Health Bangladesh program and making awareness regarding the adult health program throughout Bangladesh and to increase the milk production and also the health care of adult and so many programs he is continuously doing. So I really appreciate his team for their wonderful job, and I have been associated with Adult Health Bangladesh, and I had been to Bangladesh 2 years back to attend an international conference, and I have seen they are doing a wonderful job regarding many type of awareness programs and conference and webinars and all. So these type of programs are very much useful for the field veterinarians of Bangladesh, and really clinical transformation is going on very much in Bangladesh. So many of my students, they used to come for the internship here in India. They used to come for the internship, and then they here learn more number of techniques in the large animal and small animal. Whatever they learn, they are going and applying there in the field conditions, and they are giving the feedback, and they are having any doubt, means clarification of the doubt, and they are doing a wonderful job. So I really congratulate you all for your wonderful service to the our profession, veterinary profession. And I'm having the privilege to join with you in the 16th online discussion regarding the abomasal disorders in dairy cows. As a veterinarian, so wherever you are practicing, so in Bangladesh or anywhere, so either in India or Bangladesh or in Malaysia, a field veterinarian who is practicing anywhere in the remote area or in the field with the limited available gadgets, we always depend on the physical examination of the cases. Physical examination is more important. Clinical examination is more important. Then only we can go for the diagnosis. And we have many other gadgets like ultrasonography and other gadgets, and they can confirm our diagnosis. So we should be strong in the basic of physical examination and the clinical examination. So as a field veterinarian, we are more we are aware of the ruminal disorders. I mean, the ruminal disorders means the ruminal acidosis, rumen impaction, traumatic reticuloperitonitis. I mean, regarding pericarditis, ruminal disorders, all the other ruminal disorders, we can easily diagnose. So we are getting more number of cases, and we accommodate to them, and we clinically we find it very easy to diagnose like acidosis and other type of cases. But many times in field conditions, the abomasal disorders goes unnoticed, because sometimes it may, so many reasons are that for we may not be applying the clinical examination for identifying such a cases. Many times we could have come across such a type of abomasal disorders, but most of the time, because of not applying the clinical examination, not applying the physical examination of that particular cases, we could have missed the abomasal disorders. So I'm sure after this webinar session, after this session, I'm sure many of the veterinarians, while attending some of the cases, when you apply the basic clinical examination, what we are going to see in this 1 hour, definitely I'm sure that you can diagnose displacement of abomasum and other abomasal disorders very easily. I'm sure about that. So after the end of the session, you will be having some comprehensive knowledge regarding the abomasal disorders, and so that you can apply it and you can gain more knowledge, and you can diagnose more cases of abomasal disorders, because it is directly related to the production. All the either same like ruminal disorders, abomasal disorders are also directly related to the production. So we may be having very heavy animal, high yielding animal. So we will be treating for some other reasons, but it won't respond to that. Suppose it may be exhibiting some symptoms of ketosis, but you are treating for ketosis, but it is not responding to ketosis. But after that, what we have to do? Then we won't know what to do. So because it is not responded to the symptoms of ketosis, but exhibiting signs of ketosis, but no other signs, how to proceed, we don't know. So in such a type of cases, how to approach these cases, this session will be helpful for you to identifying the abomasal disorders. So first of all, we would like to know about the functions of abomasum. So abomasum is a true stomach. So I'll tell you the clinical anatomy. So after the picture, by showing the pictures, I will tell you the clinical anatomy of rumen, reticulum, omasum, or abomasum. The functions of abomasum is a true stomach, and it's a glandular stomach, and it secretes hydrochloric acid, and it secretes pepsinogen, and the normal abomasal pH is always acidic. As we all know, the ruminal pH is 6.7, slightly alkaline. The abomasal pH is always acidic in nature. This will be helpful to identifying the first thing when you are doing the abdominosynthesis, or when you are taking any synthesis by fluid, you are collecting any fluid, and you are seeing the pH. When you are getting the alkaline pH from the rumen means it is alkaline pH. Abomasum, it will be acidic pH. So the next thing, the common conditions of abomasum are these 4 types of things we used to come across in our field conditions. That is the abomasal displacement. The very common thing is the abomasal displacement. The displacement of abomasum may occur either to the left side or right side. You keep it in mind, either to left side or right side. Left side means that is the left side displacement of abomasum, and right side means it's the right side displacement of abomasum. Number 2 is the abomasal ulcers, and number 3 abomasal bloat, then abomasal impaction. We'll see one by one. I'm not going by case history, because I'm not going by history like one animal is presented like that. I'm not going that, because since it is a learning session, first you have to learn how abomasal displacement occurs and what are all the consequences of abomasal disorders, how to diagnose it clinically, how it occurs, the pathophysiology. That if you are able to understand, the other things will be very easy, that we can discuss in the coming other sessions. Okay. See here, just you can notice, I will tell the clinical anatomy area of organ location. See, from the 13 ribs means we have to count it from the back side, 13, 12, 11, 10, 9, 8, 7, 6, like that you have to see. Here, in the left side, the 3rd to 5th intercostal space is the location of heart. 6 to 8 intercostal space area, I mean the ventral floor of the abdomen, is the reticular area, reticulum. Beyond the 8th rib is the location of rumen. So here it is the left paralumbar fossa. It's the left paralumbar fossa. Here you can palpate only the organ rumen. So in the left paralumbar fossa, you can palpate only rumen. So what are the things in the reticulum is there? 3 to so rumen, reticulum is the left side. So you keep it in mind. This is a normal anatomical position. In the right side, when you come to the right side, so count the ribs: 13, 12, 11, 10, 9, 8, 7. From 7 to 9th intercostal space, here is the location of omasum. I mean, the location is the ventral floor of the abdomen. 7 to 9th rib is the omasum. Beyond the 9th rib is the location of abomasum. So you keep it in mind. Abomasum is located in the right side. The normal location, anatomical position of abomasum is right side, 7th to 9th rib in the ventral floor of the abdomen. This is the right paralumbar fossa. Here you can able to appreciate the cecum. So beyond abomasum, small intestine and large intestine is coming, and the cecum, colon, rectum is going like that. So left paralumbar fossa, only you can palpate rumen, no confusion at all. Right paralumbar fossa, you can, any distension in the right paralumbar fossa, it indicates anything related to the cecum. So if you keep it in mind these things, it will be very easy to proceed further. Okay. I hope you understand what are all the organs in the left side. Now we understand what are all the things in the, you can approach from the right side. See, this is the rumen, here reticulum, the right side omasum, abomasum. Behind abomasum, then small intestine, duodenum, jejunum, ileum, cecum, colon, rectum. Okay. So now you are aware and familiar about the location of the organs. Okay. So displacement of abomasum. So either it may displace from the normal side. I mean, the abomasum is located in the right side. It may get displaced to the left side. So that is called left side displacement of abomasum. And right side also, when it is located in the ventral floor of the abdomen, it is okay, it is well and good. That is a normal position. When it is displaced in the right side alone, when it is engorged and displaced in the right side alone, that is right side displacement of abomasum. And when it is twisted, it is valvulus, right side valvulus of the abomasum. So these are all the conditions we used to come across. Okay, LDA, RDA. See, this is an animation picture. So this is the right side. The liver is there. Abomasum is displaced to left side. From the right side, it is coming to the left side. Can you able to see? The abomasum is displaced from the right side to left side. It's engorged because of the fermentation. It is engorged and gets displaced and coming to the left side. This is left side displacement of abomasum. See why it occurs. Left side displacement of abomasum. First, we will see about the LDA, left side displacement of abomasum. It's very appreciable in large, high yielding dairy cows. So very much appreciable in the large, high yielding dairy cows. Mostly it occurs immediately after parturition. Mostly within 6 weeks of parturition. That you have to keep it in mind. Whenever you are attending a case of recently calved animal, which are all not responding to your routine treatment, I will tell you in detail how to approach these type of cases. You have to think about the displacement of abomasum. So in cows, you may get up to 6 months of age, the displacement of abomasum. So what are all the risk factors involved in the displacement of abomasum? Why it is getting dislocated, either to the left side or right side? Why can't it be remained in the same anatomical position? Why it is coming to the left side? That is a question. The risk factor is that the cows which are fed with a high energy diet during the dry period are more predisposing for the abomasal disorders. That you have to keep it in mind. So suppose you are going for a farm consultancy, you are attending a very big farm. Whenever we are getting many cases of metabolic disorders like ketosis, hypocalcemia and all, you have to think about all these things. The cows which are fed with the high energy diet during the dry period, that you have to keep it in mind. During the dry period, what will happen, I will tell you in detail. So inadequate level of roughages, when the animal is taking inadequate level of roughages, animal is fed with the high energy diet during the dry period, and the crude fiber level less than 17%, all these are the risk factors for the displacement of abomasum. And all above these conditions, these occurs during the last few weeks of pregnancy. So we have to take care during the last few weeks of pregnancy regarding the feeding management. So what is a lead feeding? We used to say on lead feeding, feeding of concentrates. I mean the high producing cows are fed with the concentrates in the last few weeks of dry period, so that we are preparing for the animal for the transition period from the pregnancy to the lactation. So these type of animals, they have a high risk of LDA when they are giving with feeding of more concentrates. So after parturition, it's no problem. Before itself, if you are preparing these type of high producing cows with the feeding more concentrates, they will predispose to the risk of LDA, because the high grain feeding may increases in the production of volatile fatty acid, VFA, increase in the production of volatile fatty acids, that increases the fermentation, and that inhibit the increase in the VFA will inhibit the abomasal motility. Once the motility of the abomasum is lost due to the fermentation or continuous fermentation, the abomasum will start engorging and it will get displaced. Either it may displace to right side or left side. So ketosis is the common complication of one of the common complication of displacement of abomasum, LDA. And usually in the farm conditions, evaluation of AST, aspartate transferase, and beta hydroxybutyrate in the first few weeks of parturition predicts the diagnosis of LDA. For example, if you are in a farm, working in a farm, when there is a elevation of AST and beta hydroxybutyrate in the first 2 weeks of parturition in some of the animals you are suspecting, is to think about these animals are going for LDA or having for LDA, like that. Early signs of LDA. So here the abomasum is getting engorged and it's getting displaced. Like this only, it will get displaced to the from the normal anatomical position to either it may become to the left side or right side. See here in this picture, the abomasum, this is the left side. This is the left side of the animal. The normal anatomical location of the abomasum is the right side. It should be in the right side. Where it is coming, it gets displaced and dumped to the left side. So from the right side, it gets displaced. I mean, because of the fermentation of the gas, it gets distended. The abomasum gets distended and it comes to the left side. We'll see how it is coming to the left side. See, the high energy diet, the pathogenesis is that the high energy diet which is fed to the animal will lead to obesity of the animal, obese. And naturally, these animals, they will have the decline in the dry matter intake. The dry matter intake will be very much less. So the filling of the rumen will be reduced. The rumen will, the filling, the quantity, the rumen fill will be reduced and the volume will be reduced so that the size of the rumen will be reduced. So naturally, when the size of the rumen is reduced, the forestomach motility and the low abomasal motility is having a very good opportunity to come against the rumen to the left side. This is the pathogenesis of displacement of abomasum towards the left side. For example, see this picture. The animal is a pregnant. This is a pregnant animal. This is the rumen. This is the rumen. Here, in the first trimester or second trimester of pregnancy, the uterus, the first trimester of pregnancy, the uterus is here in the pelvic cavity. You can see this. This is the, you assume it. This is the uterus and it is in the pelvic cavity. When the pregnancy advances, the uterus is descending downward in the ventral abdomen. See, the uterus is distended towards the ventral abdomen and the distended uterus will go and compress the rumen here. See, you can able to see the picture here. It will compress the rumen here. Naturally, the rumen will be compressed by the uterus. So the rumen quantity, the quantity of the rumen will be reduced. The size of the rumen is reduced in size so that there is a gap between the rumen and the uterus here. So when the animal is pregnant, the uterus is compressed and it is pressing the rumen and the size of the rumen is reduced. Immediately after parturition, what is happening? Already we are feeding the animal with the high grain content and low roughage intake. That also will lead to reduced rumen fill, and the animal is the see, during the pregnancy. I mean during the parturition. After parturition, the uterus will involute. So the uterus will involute and go back like this. And here the reduced rumen size. Because of the reduced rumen size, there is a gap underneath the rumen. So naturally, the abomasum, which is getting more volatile fatty acids and fermentation and distended abomasum with no motility, naturally it is having a gap near the rumen. It comes near the rumen and comes to the left side. So this is how the displacement of abomasum occurs during the after parturition. I mean immediately after parturition during the first 6 weeks. The main thing is reduced size of the rumen is one of the factors. So as I already told, that related to the feeding management. See, the uterus compresses, that will lead to the reduce in the size of the rumen, and after parturition, the rumen size will be reduced. The abomasum will have a small area to escape through that gap to get displaced to the left side. So which are all the animals are predisposed, as we have already seen? Cows in high grain ration and less saliva production and less rumen buffer. These are all the predisposing causes for the left side displacement of abomasum. So how to appreciate the clinical signs? So we may be coming across many number of cases like ruminal acidosis. You can easily diagnose by palpating the rumen. You can appreciate the fluid splashing sound. Diarrhea will be there. Like that, so many clinical signs we can appreciate the ruminal acidosis. How we can diagnose the LDA? Here, the occurrence of displacement of abomasum occurs within few days to week after calving. That is one of the important points you have to keep it in mind. So all the recently calved animals, within 6 weeks, any case with the complete anorexia, reduction in the milk yield, and the scanty feces or reduced quantity of the feces, you have to suspect displacement of abomasum. So that will be complete anorexia, reduction in the milk yield, and the slab-shaded abdomen means there will be distension of the abdomen, and all the temperature, pulse rate, respiration rate will be normal in nature, and it will vary according to the other complications. For example, if the animal is having peritonitis, then the heart rate will be varying. Otherwise, there won't be any difference in the temperature, pulse, and respiration rate. Regarding the dung quantity will be reduced in quantity and softer in nature. The other important thing is that we have to do the physical examination and identify whether there is any ping sound is there or not. That is the most important thing in the identification of displacement of abomasum. Here you can appreciate the ping sound in the upper third in between the 9th to 12th rib of the left side. In case of LDA, you are getting the ping sound in the left side in the 9th to 12th rib of the left side. So I will show you how to identify the ping sounds. In the rectal examination, the rumen will be very much small and displaced to the right side. I mean the rumen will be very much small in nature. We can able to feel the rumen, which is very small, and some sense of emptiness in the right upper abdomen. Some sort of emptiness you can able to notice. So when you are doing the physical examination, see this picture. This is the left paralumbar fossa. Can you able to see any difference in this picture in the left paralumbar fossa? When you observe very keen, you can able to see the difference of a small glandular structure. It's a separate glandular structure bulging, that is a displaced abomasum. See, this is the left paralumbar fossa. As I already told, you can palpate only the rumen through the left paralumbar fossa. But here, this is the rumen. You can able to palpate. When you are doing the palpation, you are able to appreciate a glandular structure here. There is some difference, so that you can identify two organs here. One is the rumen, and this is the rumen. See, this is the rumen, and this is the abomasum. So this is the rumen, and this is the abomasum. In normal animal, you can able to see only rumen. In the left paralumbar fossa, you can able to palpate only rumen. Here, since the abomasum is displaced from the right side to the left side, you can able to palpate the half moon shaped glandular structure beneath the last costal rib, very easily to appreciate. Okay, by physical examination, we can able to appreciate. So first step, we have appreciated the separation. I mean, we have appreciated a half moon shaped glandular structure in the left paralumbar fossa, just caudal to the last rib. So you are having a doubt whether it is a abomasum or any other thing. So you have to go for a physical examination. What to do? You have to take your stethoscope. You have to take your stethoscope, and you have to do the auscultation simultaneously percussion. Auscultation with the percussion, so that you can appreciate the ping sound. What is a ping sound? Ping sound means like making a coin, like when you make a coin in a toss, you can able to appreciate the sound. That is a classical sound, is called the ping sound. It's very much appreciable in case of abomasal displacement. See, this is the rumen, this is the abomasum. Okay, by palpation, you can able to easily differentiate. This is a small clinical examination, you can differentiate. See, you can see this picture. This is the rumen, the left paralumbar fossa. Here you can able to appreciate the half moon shaped glandular structure beneath the last rib, caudal to the last rib. So you can palpate and appreciate the difference between the rumen and abomasum. A glandular structure. For example, it's a glandular structure. Some difference is that you want to verify whether it is a abomasum or any other things. So how will you diagnose? Diagnose history: recently caught animal, not responding to any type of treatment, routine treatment, and then by clinical examination you have observed what are all the things what we discussed, and the ping sound, appreciation of ping sound in the left side, especially from the 9th to the 12th intercostal, 12th rib. And if you are having the ultrasonography, you can confirm your diagnosis by ultrasound very easily, and you can do the lip tap test. I will tell you what is the lip tap test. This is all the mode of diagnosis. This all we can do it anywhere in the field conditions. See, I am suspecting a left side displacement of this cow. So it's the left side. As already told, this is a left paralumbar fossa. So here 13, 12, 11, 10, 9. In this area, you keep your stethoscope in the intercostal space and do the percussion and auscultation and identify whether there is any ping sound is there or not. Here, first you do it in the left parallel fossa and do it in the intercostal space 13, 12, 11, 10, 9. So wherever you are getting a ping sound, then you can put a mark with a chalk piece and you can identify and put a area. These are all the area we are getting the ping sound, so that we can identify the ping sound. Intensity of the ping sound is more in this area like that. See, like this you have to palpate. You have to palpate the left parallel fossa like this and see whether there is distended is there or not. Then from the 13th to 9th rib, you do the auscultation with the percussion. I have put a mark here with the chalk piece because I got a ping sound in this area. I got a ping sound in this area, so I am marked with the chalk piece with that area. Wherever I am getting the ping sound, I am marked already. So you have to auscultate, and with the finger, you tap it like this in the intercostal space, and don't keep the stethoscope in the rib, so you'll be feeling a metallic sound. So don't keep the stethoscope in the ribs, keep it in the intercostal space and percussion in the intercostal area. Don't percuss in the rib also. So definitely you can appreciate the normal sound. First you have to do it in normal animal, then you can do it in the you can, whenever you are getting cases, you can easily identify. See, like this, you have to do the auscultation and percussion, and you can able to hear the ping sound, very loud sound. Ping sound means, so you mark that area. Then we go for the other test called lip test. First, you have to make aware of this clinical procedure, that is the auscultation with the percussion. Okay. Then what is lip test? Lip test means just you are introducing a needle by aseptic precautions, by applying aseptic precaution, by applying that after aseptic precaution, by applying povidone and all, you insert a 16 gauge or 18 gauge needle in the area where you are getting the ping sound. So please keep it in mind. After doing the aseptic precautions with povidone and all, you apply there. And for example, you are getting a ping sound in the 9th to, say for example, you are getting a ping sound in the 9th to 12th rib. So you can insert the 16 gauge or 18 gauge needle and aspirate the content of the whatever may be coming, and see the pH. If it is alkaline in pH, it is a rumen. If it is acidic in pH, it is a clear case of abomasum. Definitely. Very simple technique will lead to identification of the displacement of abomasum. So that is called the lip test. See, this is the lip test. So I am introducing the needle where I am getting the ping sound, more intensity of the ping sound, and I am aspirating the content and seeing the pH. So this is called lip test. Okay, and you are seeing the pH. See, the pH is acidic in nature, so that indicates that area. In that area, what I have put the needle and I have done the synthesis. In that area, abomasum is located. As we all know, the abomasum normal location is the right side, but we are getting now in the left side, in between the 9th to 12th rib. So that indicates left side displacement of abomasum. So we can diagnose very easily by means of clinical examination, by doing auscultation with the percussion and appreciating the ping sound, and putting the needle and aspirating the content. That is called the lip test, and seeing the pH. So this is very easy to diagnose the displacement of abomasum. See this case, like this scanty feces, the quantity of the dung will be reduced in nature. Very little amount of dung will be voided. No, not large volume of dung. The dung will be scanty in nature. Okay. Very little quantity of the dung will be voided. And this is the ultrasonography. If you are having ultrasound, you can very well appreciate the abomasum location. And the ultrasound is an excellent tool in aid of the diagnosis. So we can confirm our diagnosis. First, physical examination is more important. First, you have to physically examine by auscultation and percussion and appreciate the ping sound. Then go for the lip test. Then you can confirm your diagnosis by ultrasonography. It's very easy to perform. See, in the left side, you can able to see the location of the abomasum, distended abomasum in the left side. You can see the glandular organ. See? In the left side, we can able to, this is the abomasum, and normally it should be in the right side, in the ventral floor of the abdomen, the right side, but it is now, we are getting in this case in the left side. So it is a clear case of left side displacement of abomasum. Okay. So regarding the clinical biochemistry, what are all the things it will be there in the displacement of abomasum? There will be hypochloremia, hypokalemia, and metabolic alkalosis will be there. So there will be low potassium level, and metabolic alkalosis is a classical thing, and paradoxic aciduria will be there. Ketonuria will be there. So whenever you are appreciating the ketone bodies in the urine and you are treating the animal for ketosis, and the animal not responding to the ketosis, and again the recurrent ketonuria is there, you suspect abomasal displacement. That's a simple logic. So whenever you are getting a ketosis case and you are treating the ketosis case and not responding to that, and again it is recurring and not responding to your ketosis treatment, you think about fatty cow syndrome and abomasal displacement. And by clinical examination, we can very well easily diagnose this type of cases. Okay. And the blood glucose level is always mostly normal to elevated in nature. So whenever you are getting a blood glucose level elevated in nature, also you think about the displacement of abomasum, and also elevated AST and beta hydroxybutyrate, you think about abomasal displacement. These are all very easy to narrow down your diagnosis. So in field conditions, you can use this type of glucometers, whatever which are using for our human practice, that you can use it for identification in the field practice. Just you can take a drop of blood and you can see the glucometer, how much of glucose is there. It's very much appreciable in case of identifying the ketosis cases also. You can do it in your routine practice in the field conditions. And there are some beta hydroxybutyrate strips are available from the market that you can get it, and you can see the ketone body from the milk and the urine, and the beta hydroxybutyrate will be giving positive. Okay, this type of strips are commercially available that you can get it from the market, and you can use it in your field practice. And the keto sticks, these are also available from Bayer. This is also available that you can use it for your field practice. Very much useful for identifying presence of ketone bodies. So what we use for identification of the ketone body in the routine conventional thing is the Rothras test. In Rothras test, they will be sensitive to only acetone and acetoacetic acid, not to beta hydroxybutyrate. So this type of using of strips will be very much helpful in identifying the cases of ketone, to identifying the ketone bodies or ketosis. So this type of urinalysis strip also can be used to identify the ketone bodies. So this type of gadgets, if you are using in the field conditions, it will be very much useful for narrow down the diagnosis. So you need urinalysis strip that are, and also a glucometer to see the level of the glucose, and also ketometer is also available in the market. See here the glucometer, the glucose level is showing 155. It's a high. So normal glucose level is 50 milligram, and here you are getting the hyperglycemia. And the ketometer are also available, the same thing in the market. Just to put a drop of blood, immediately it will show the level of the ketone bodies present in the blood. If it is very high, it will show like this. It will show like this, high like that. Okay, so that you can very easily identify the level of the ketone bodies in the blood. Okay, these are all available for the market, commercially available. That you can use it very well for the field conditions. So regarding the ping sound, how to identify this ping sound? In the left side, you are getting a ping sound. You can go to the YouTube and search the abomasal displacement. There are many number of videos which are having the ping sound. You can learn wow about the sound. Once you get impressed in your mind, you can easily diagnose this type of ping sounds. So I will tell you, suppose if you are getting a ping sound in the left side, you think about left side displacement of abomasum. In the right side, you are getting the ping sound, you think about right side displacement of abomasum. So what are all the other conditions which are exhibiting the ping sounds? In the right paralumbar fossa, when you are getting the ping sound in the right paralumbar fossa alone, and also cranial to 1 or 2 ribs, means you have to think about cecal dilatation also. Cecal dilatation and the cecal volvulus or distended colon or rectum in the gas. These are all the things you have to keep it in mind as a differential diagnosis. So in cecal dilatation, what we have to do when you are getting a ping sound in the right paralumbar fossa, you suspect cecal dilatation, cecal involvement, or right side displacement of abomasum. So when you are going and palpating the per rectum, when you are doing the rectal examination, you can able to feel a very big mass, in the longitudinal structure. Like going like this means that is a clear case of cecal dilatation, as if you are holding your hand and palpating an organ, like a mass, a very big mass. It's a cecal dilatation. So when you are going to when you are having a feel of ventral portion, when it is going downwards, upward to downward, then you can suspect abomasal displacement. Like this, by clinical examination, you can narrow down the diagnosis and you can apply it by lip test. So you can apply the lip test and see the pH. If it is acidic pH, it is abomasum. If it is alkaline pH in the right side, it may be from the intestine. So that it is very easy to classify. So some cases we used to call as floaters, some LDA, displacement of left side displacement of abomasum, spontaneously they will get resolved when it is treated symptomatically by fluid therapy and giving calcium, and when the animal is made to walk, it will come back to the normal. Some cases they are called floaters. Okay. So fluid splashing sound in ruminal acidosis, we can appreciate the fluid splashing sound in the left paralumbar fossa, so that it will be very easy to diagnose acidosis case. When you are able to appreciate the fluid splashing sound in the right paralumbar fossa, you have to think about the cecal dilatation or distended intestinal loops. And the right lower, or if you are getting a fluid splashing sound, you have to think about intestinal distension. So these are the things, they will give you a clue for classification of each and every conditions very easily. Just by palpation, you can differentiate these conditions. See, this is the how we have to do percussion with auscultation. So you can do in all the cases, normal cases, whenever you are suspecting such a cases, you do in all the cases. Definitely you will identify the ping sound. So here, why I put this video, this is the case. See, here I am doing the auscultation and the percussion in the left paralumbar fossa and also in the intercostal space. And you are getting a ping sound in the rumen, I mean, in the distended left paralumbar fossa and also the intercostal space. But the animal is not recently called animal. So naturally, we have to differentiate from two things: abomasal displacement and rumen distended. Okay. Whenever the rumen is distended in acidosis, also you'll be getting the ping sound. So this is a case of acidosis. This is brought to the hospital with a history of consuming large quantity of concentrates. I mean the kitchen waste they have fed, and it got acidosis, and the rumen is got distended. And in this case, you are getting the ping sound. How to differentiate? So you'll be getting the collecting the rumen liquor, and you'll be seeing the pH. Acidic pH will be there, or milky white nature will be there. Fluid splashing sound will be there. Any distension of the organ will lead to ping sound. So we have to differentiate whether it is a rumen or abomasum. That is our duty. So here in ruminal acidosis also, ping sound similar to abomasal disorders will occur. So you have to differentiate. Okay, how to differentiate in rumen? If you are getting the ping sound from the rumen distension, I mean here the rumen motility will be completely absent in case of ruminal acidosis. Okay, there the rumen structure will be different, the abomasum structure will be different. You can able to appreciate the ping sound separately, and the rumen motility is separate, so that you can differentiate very easily whether the ping sound is due to the distended rumen or displaced abomasum. Even if though if you are having that requires some experience, by continuous percussion and auscultation in some cases, you can able to come to a conclusion. So don't get confused. In rumen acidosis also you'll be getting the ping sound. You have to correlate with other clinical signs and differentiate. And you can confirm by lip test also. Whenever you are having a ping sound, put a 16 gauge or 18 gauge needle and aspirate the content. That is a lip test, and see the pH. If it is acidic in nature, it is a displaced abomasum. If it is alkaline in nature, it is a rumen. So very easy to diagnose simply by clinical examination. So regarding the treatment and the management, the fluid therapy, the best thing is a fluid therapy. So you have to go for a massive fluid therapy and balance electrolyte solutions like ringer lactate you can give, and you can supplement the calcium, and prokinetic drugs like erythromycin or azithromycin can be given IV, at the rate of azithromycin means you can give at the 8 milligram per kg body weight, and make the animal walking so that spontaneously it will recover. So this is all regarding the medical management. Regarding the medical management, the best thing is you have to correct the electrolyte imbalance. That is the most important. Correct the electrolyte imbalance by giving fluid therapy. The calculated fluid therapy should be given. So 1 or 2 sachets or 1 to 2 liters is not at all sufficient. You have to go for calculated massive fluid therapy. You have to go with the balanced electrolyte solution like lactate. And for enhancing the motility, you can give calcium, and the prokinetic drugs like erythromycin, azithromycin can be given, and you can make the animal walking. So whenever there is a displaced rheumatism of mild or moderate cases, spontaneously it will dissolve. Okay. And there are other methods like rolling method. Many practitioners, some textbook you might have read, they will keep the animal in the dorsal recumbency in the right side. They will keep the animal in the right side and make it in the, they will tie both the forelimb and the hind limb, and they will keep the animal in the dorsal recumbency. In the 180-degree angle, they will be having a rolling method, and then they will keep it on the right side and make the animal stand and walk. So in these conditions also some times it will get corrected. So that is called the rolling method. If it is not responding to the medical management and all, then they will be going for the surgical management. There are many surgical procedures are there, like abomesotexy and many other procedures are there. I am not going in detail about the surgical management. That will be discussed separate later. And toggle pin method, and so many things are there. So first here we are emphasizing more regarding the understanding the abomesal displacement, how to diagnose it physical by means of physical examination, and how to manage it medically. Then if it is not responding to your medical management, then you have to go for surgical management. The complications of LDA, what are the complications of LDA? Mostly we will be getting peritonitis. So that is the complication of the how to identify peritonitis. I will show the video. You have to do the abdominocentesis and rule out whether there is any peritonitis there or not. Then perforating abomesal ulcers is there, are the complications. And sometimes you will be getting pneumoperitoneum. So in pneumoperitoneum, you will be getting ping sounds in both the left and right side. So left side ping sound means you will be thinking about left side displacement of abomesal. Right side means you will be thinking about right side displacement. So when you are getting a ping sound in both left and right side, you think about it's a case of pneumoperitoneum. So in all these above conditions are of unfavorable prognosis. When you come across pneumoperitoneum or perforated abomesal ulcers or peritonitis, these are all the complications of LDA which leads to the unfavorable prognosis. So here in pneumoperitoneum, it's very easy to diagnose per rectum also. So you will feel somewhat empty structures in the per rectum, and you cannot able to palpate any organ in the per rectum. So in normal animal, you can able to palpate the organs like uterus and other intestine and everything you can able to feel. But here you cannot able to feel in the pneumoperitoneum. And also you will be getting the ping sound both left and right side. So this is the procedure of abdominocentesis. So the animal is standing posture is the left side from the xiphoid cartilage, 5 centimeters caudal and 10 centimeters lateral. So after aseptic precautions and applying odonidine and all, you insert a 16 gauge or 18 gauge needle and see whether there is any peritoneal fluid is there or not. See, that should not be the flow of peritoneal fluid like this. If you are coming across the free flow of peritoneal fluid in the abdominocentesis, it's a clear case of peritonitis. So it's a cranial abdominocentesis. Caudally also we can do. Caudally means you have to do in the right side because the left side is the rumen. You have to go to the right side and show that. So this is another one side. This is another one video. See the free flow of peritoneal fluid is serous sanguinous in nature. Serous sanguinous in nature means that indicates some organ inflammation is involved. So that will be leading to the poor prognosis. So from xiphoid, 10 centimeters caudal and 5 centimeters lateral. Just you put a 16 gauge or 18 gauge needle and verify. So this type of things won't respond to your treatment. This is a clear case of peritonitis. So in the field condition, we should learn how to do the abdominocentesis, in which you can diagnose many number of peritoneal diseases. I mean the traumatic reticuloperitonitis or any other foreign body syndrome very easily in the field conditions. And also another one important thing is the stomach tube intubation. So you can introduce the stomach tube and you can examine the rumen liquor. So just you can examine the rumen liquor, whether it is watery in nature or frothy in nature. So if it is frothy in nature, you can differentiate the frothy blood. Rumen contents which are frothy in nature, you can differentiate the frothy blood. You see, this is a case of frothy blood. So by introducing the stomach tube, we can very much identify these type of cases, and you can differentiate. The pink sound is not due to the abomasal displacement; it is due to the frothy blood or distended rumen like that. Like that, you are getting LDA in calves also. We used to get in some cases in the calves also the displacement of abomasum. The clinical signs will be inaptitude, reduced in weight gain, and in calves, recurrent distension of the left parallel fossa. You keep it in mind, recurrent distension of the left parallel fossa is an indicator you have to think about LDA. For example, you are getting a case of bloat in a calf. You are treating for bloat as conventionally for a bloat with your routine treatment or symptomatic treatment by giving anti-foaming agents and everything, but it is not at all responding. Recurring tympany, the recurrent distension of the left parallel fossa, you have to think about the left side displacement of abomasum in calves. So you can able to appreciate the pink sound and also the fluid splashing sound in the left parallel fossa. So in calves, so you can put the stomach tube and you can get relief, and recurrent tympany again it will be occurring. You think about this displacement of abomasum. So in calf, whenever you are putting the stomach tube, you just make the calf. So you can lift the forelimb, then you can introduce the stomach tube so that it will be easy to identify. Then we can, regarding to the right side displacement of abomasum, the same thing. Etiology that the same thing, because of the abomasal atony and the gaseous distension due to the grain feeding, the abomasum gets displaced. Previously, we have seen the abomasum gets displaced to the left side. Sometimes in some animals, it may get displaced to the right side. So 3 to 6 weeks after calving, mostly it's around parturition. The clinical signs are same as that of LDA. Only the thing we have to identify whether it is displaced to left side or right side by physical examination. So here the inaptitude to anorexia will be there. Reduced quantity of the dung, as already told, scanty feces or reduced quantity of the dung. You have to think about 4 stomach disorders, and you have to clinically examine and narrow down your diagnosis. And the pink sound in the right side, middle to the upper third of the abdomen. I will show the picture. The same thing. The pink sound in the left side indicative LDA. Right side is the RDA. And if the abomasum is involved in the volvulus, abomasum volvulus is there, naturally the animal will be having tachycardia will be there. In volvulus, sometimes they lead to rupture in 40 to 90 hours, 96 hours, that will lead to complication and the collapse of the animal. And the fluid splashing sound in the middle third of the right side abdomen. And you can get the pink sound in the right side from the 9th to 13th rib. There in LDA, same thing, 9th to 12th rib or 13th rib or whatever may be. In the left side, here you are getting the pink sound in the right side. When you are getting the pink sound extending beyond the 8th rib, for example, 13, 12, 11, 10, 9 that we are seeing, no? When you are getting the pink sound extending beyond the 8th rib, extensively, when it goes beyond the 8th rib, it is a suggestion of displacement of abomasum with the liver displacement and abomasal volvulus. Okay, that you can tentatively keep it in mind for your diagnosis. When you are getting the pink sound up to the 13th rib to the 9th rib, it's okay. When the pink sound is extending beyond the 8th rib, you have to think about the abomasal volvulus. See, this is the right side. Previously, we have done in the left side. This is the auscultation with the percussion you are doing in the right side. See the 13th rib, 13, 12, 11, 10, 9. So in the intercostal space, you auscultate and do the percussion and identify the pink sounds. Very easy to diagnose. And you can mark the area where you are getting the pink sounds, and then you can introduce the needle and aspirate the content. Okay. So this is the area I got. So this is right palmar fossa. So in case of cecal dilatation or cecal volvulus, you will be getting pink sound in the right palmar fossa. It may be extending up to 1 rib or 2 ribs like that. Suppose you are getting the ping sound extensively from the 13, 12, 11, 10, 9 like this, you can note down this area and do the lip tag test and aspirate the content and see the pH. If it is acidic in nature, it is a displaced abomasum, the right side. As we all know, the abomasum is located here in the ventral floor of the abdomen, the right side. Because of the fermentation and the abomasum atony and distant abomasum, it gets displaced in the right side like this. We can easily find it out by clinical examination. See, when you see the animal from the back, rear view, you have to stand from the back of the animal, and when you observe the abdominal shape, there will be distension of the abdomen in the right side. Okay, the right side abdominal distension will be there in case of the abdominal displacement. And in pneumoperitoneum, there will be bilateral abdominal distension. That means both in the dorsal aspect. So the treatment aspect, the same thing, the administration of the prokinetic drugs and the fluid therapy and massive fluid therapy with electrolyte supplementation. And if there is no response to the medical management, you have to go for the surgical corrections. And the main thing in all the displaced abomasum will be getting hypochloremia and hypokalemia. So you have to supplement potassium chloride orally. So you can supplement potassium chloride 120 gram orally per day, along with the sodium chloride 100 gram. If you are having an infusion pump, you can supplement these electrolytes by oral infusion pump also. The post-operative therapy also, you have to monitor the potassium content, level of the potassium, and you have to supplement accordingly. And regarding the prognosis assessment, we have diagnosed the case. For example, in a farm, when you are attending a case, you have diagnosed the case as a displaced abomasum, either it may be LDA or RDA. And how to assess the prognosis. The prognosis assessment in the LDA, when it is early attended, it is well and good. It will recover, very fruitful recovery will be there when it is attended earlier, before complications. In right side displaced abomasum, mostly it is guarded to poor if it is a delayed attempt. And when it is a case of volvulus, it is always a poor prognosis. And increase in the heart rate. When you are attending a case of displaced abomasum and the heart rate is increased more than 100 means it is a poor prognostic sign. You have to keep it in mind. And also the subnormal temperature. Whenever you are treating a case of displaced abomasum and the animal is exhibiting a subnormal temperature, even after the treatment also, even after giving calcium and all the treatment, still the animal is in the subnormal temperature, it's also a poor prognostic sign. And persistent ketonuria, even after the treatment management, everything, persistent ketonuria is a poor prognostic indicator. And the increase in the blood lactate level, blood lactate level is also a poor prognostic sign. And also increase in the rumen chloride content, because that indicates the stages of the abomasum. Once the abomasum is obstructed, naturally the rumen chloride content will be elevated. These are all the indicative of poor prognostic signs, and you can assess the case by this criteria, and you can tell the outcome of the case, how it will be. The diagnostic and prognostic indicators are the ketosis. Whenever you are attending, sometimes in the field condition, whenever you are attending a case of ketosis case, and you got a positive result in the urine strip also, so you are treated the animal for ketosis, but it is not responded to your treatment. Again, it is showing symptoms and scanty feces, there, distant abdomen is there, persistent ketonuria is there. You think about displaced abomasum and go for clinical examination to identify whether it is a LDA or RDA. Then ping sound, appreciation of ping sounds. In the recently covered animal, you go on do this in all the cases. From today onwards, whenever you are getting any case of a recently cowed animal not taking feed, reduction in the milk yield, scanty feces, you take the stethoscope and keep the stethoscope in the left parallel fossa and also in the left side, left intercostal space, I mean the intercostal space, from 13th to 9th rib. Do the auscultation and the percussion. Okay, do the same in the right side. You can easily diagnose the abomasum displacement, whether it is LDA or RDA. So this technique you have to learn from today onwards. And recently cowed animal cases, up to 6 to 8 week of cases, any cases which you are attending with the scanty feces or tympany or not taking feed, reduction in the milk yield, you do this clinical procedure, auscultation and the percussion. Definitely you will come across a ping sound one day, and immediately you do the lip tag test and identify the pH. If it is acidic in pH, it's abomasum. Okay, very easy to diagnose. And also you see the heart rate, whether it is a normal in nature, in rate, normal rate, or any increase in the heart rate and all, to think about. And tachycardia is a poor prognostic sign. Okay. And also the blood lactate level. If you are having facilities for seeing the lactate level in the blood in the infusions, you can see the blood lactate level, or you can give the, any laboratories, and you can see, and the less than 2 millimole per liter is of a good prognosis. And if blood lactate level is more than 6 millimole per liter, it is of poor prognosis. So this is how we can say the prognosis about the displaced abomasum. So how to control or prevent this type of prevention? I mean, the prevent or control means the feeding large quantity of roughage in the late pregnancy period. Why? What is the reason behind feeding large quantity of the filling of the rumen should be there? That's why by giving more quantity of the roughages, the filling of the rumen will be there. Once the rumen is filled, there won't be any gap between the uterus, and after the calving, the uterus is getting involuted. The rumen is having a proper filling, means the abomasum won't get a space to displace to the left side. That is the concept of giving a large quantity of the roughage in late pregnancy period. And exercise like making the animal walk for some time daily, and avoid giving excess amount of high grain in the feed, and monitor the dung quantity in the farm animals during the parturition and the postpartum period. Whenever you are coming across any animal having a passing a small quantity of the dung, you think about poor stomach disorders and go for the physical examination. And whenever you are getting the urine ketone bodies positive, you think about the ketosis. And whichever the cases which are treating for ketosis, not responding to the treatment, think about abomasal displacement. And also avoid sudden changes in the feed after calving. So avoid a sudden change in the feeding management, and ensure proper rumen fill by giving adequate roughage intake, as I already told in the first point. And feeding TMR, total mixed ration, can be suggested instead of giving split feeding of grain. By this mechanism, by these measures, we can be able to control the displacement of abomasum. Okay, so this is all regarding the abomasal displacement. So whenever you are coming across, when you are learning this as a first time, you will be getting very fast. Just I have given information. In nutshell, I have given the information about the displaced abomasum, and only the thing you have to identify the case: recently calved animal, reduced quantity of passing, reduced quantity of the dung, reduced feed intake, reduction in the milk yield, not responding to your routine treatment, tentatively suspect abomasal displacement. Simple logic to do the auscultation with the percussion in the left side and the right side, as I already told in the previous slide, and identify the area of the ping sound. If you are getting the ping sound, do the lip tap test and see the pH. You can very easily identify the abomasal displacement hereafter. Okay, it's very simple to diagnose. Okay, these are all regarding the displacement of abomasum. Okay, either it may be LDA or RDA. And now I will tell you about the other important case of abomasum, which we come across in the field conditions, which may go unnoticed many times or not responded to many times, is the abomasal ulcers. For example, a crossbred HF cow or any Jersey cow, whatever may be, and not taking feed and water since few days, and bruxism is noticed. Bruxism means grinding of the teeth, and the animal is passing dark tarry colored feces. Dark tarry colored feces, either it may be a semi-solid in nature since a few days, means you have to think about abomasal ulcers. See, this is the dark tarry colored feces. You will be getting this type of feces in the thaleraces also, because of punched ulcers in the abomasum. You will be getting this type of dark tarry colored feces. And what are the reasons? Other reasons, mainly the indiscriminate use of non-steroid anti-inflammatory drugs, indiscriminate use of NSAID. So whenever you are using NSAID, you use it in the proper dosage, otherwise it will lead to the complications of abomasal ulcers. There are different types of abomasal ulcers, like non-perforating with bleeding, and number 3, perforating abomasal ulcers with localized peritonitis, perforating abomasal ulcers with the diffused peritonitis. In these things, perforated abomasal ulcers with the diffused peritonitis will be of poor prognosis, and other things can be managed well, and you can treat the animal and bring back to the normal conditions when it is presented earlier. So the first two conditions, non-perforating abomasal ulcers or non-perforating with the bleeding, can be very well corrected and bring back to the normal very easily. and to some extent perforated abomasal ulcers with localized peritonitis depend upon the individual animal how it responds to the treatment. Okay. So it occurs either in the large animal and adult cattle and also in the calves. And the use of NSAID is indiscriminate use of NSAID. For example, whenever you are using meloxicam or flunixin, you use the proper dosage, recommended dosage alone. Some practitioners, they will use the double dose, or they will use more prolonged for a prolonged period. For example, you are treating a case of mastitis. Already the recommended dose, calculated dose, you are getting some 10 ml means by psychologically you will have a psychological feeling that 10 ml is not sufficient for this massive body weight animal, and you will be taking 20 ml or 25 ml like that, and you will be giving some meloxicam or flunixin or ketoprofen, whatever may be. And sometimes you will be thinking in mind, use of one NSAID may not be useful in reducing the swelling of the udder, and also can I use one more NSAID, like you will be combining flunixin with the ketoprofen. You will be combining the meloxicam with the ketoprofen. Like that, you will be doing some practice. Some practices they used to do. So this type of practice should not be there. You have to use any one NSAID, non-steroidal anti-inflammatory drug, means any one for the therapeutic purpose. That too as a recommended dosage, not beyond the recommended dosage. When you are using it two combined NSAID, when you are using it for more prolonged period, that definitely will lead to abomasal ulcers. The animal will pass dark tarry colored feces. So definitely, then it will be very difficult to manage this type of cases. So whenever you are using NSAID, think twice how much you have to use it and how long you have to use it. And you have to use it whenever it is needed, and that too for a short period. Okay. Don't go for using for 5 days, 10 days like that. Definitely it will lead to abomasal ulcers. And feeding of coarse roughages, sometimes feeding of coarse roughages also will lead to abomasal ulcers, and stress related and related to the sequelae of LDA, RDA will also lead to abomasal ulcers. High starch content in the diet and subsequent to the stress content, the concurrent diseases like metritis, mastitis, ketosis, and displaced abomasum, and lymphosarcoma, all these things will lead to abomasal ulcers. In some calves, you will be getting dark tanicular feces because of feeding of poor milk replaces and the clostridium, development of the clostridium in the abomasum. So the clinical signs is very obvious. The farmer will be telling the animal is passing dark tarry colored dung, as already shown in the previous picture, and the mucous membrane will be pale in nature because of the abomasal ulcer. The bleeding will be there. The animal will become anemic, and because of the pain, the animal will exhibit the grinding of the teeth, that is bruxism, and tachycardia will be there, and reduction in the milk yield will be there. When it is complicated and perforated, that will lead to peritonitis. So the obvious clinical sign is melena, digested blood will be there in the dung, that is a dark tarry colored feces. So there are some diagnostic things which can use. Can use the plasma gastrin concentrate. If you are academic purpose, we can use these things. The plasma gastrin concentrate level will be increased. Plasma, that is serum pepsinogen concentration, will be more than 5.5 units per liter, is indicative of abomasal ulcers. So these are all for the academic point of view. For practitioners, how to approach the diagnosis, you can appreciate the melena, dark tarry colored feces. If you are able to see the CBC, you can able to appreciate the anemia in such a cases. And if you are having a facilities, you can send the dung sample to the laboratory for seeing occult blood tests. Okay, occult blood test, OCCULT, occult blood test. If you are sending a dung sample to the laboratory, they and recommending the occult blood test means that is it, to identify the digested blood, whether there is presence of digested blood in the dung or not. So if it is positive for occult blood test, it is indicative of abomasal ulcers in ruminants. Okay, it's very easy to diagnose. And regarding the treatment, the recommended treatment in calves, we can give ranitidine 10 to 50 milligram per kg in calves orally. In ruminants, we come across very good results by treating with the pantoprazole. Pantoprazole, we can give 0.5 to 1 milligram per kg body weight IV for 3 to 5 days. Will give you a dramatic improvement in the abomasal ulcers. We used to treat all the abomasal ulcer cases successfully with the pantoprazole, 0.5 to 1 milligram per kg body weight. It's very successful. And also you can use antibiotics like penicillin, streptopenicillin or penicillins can be used to counteract the localized peritonitis. And the fluid therapy can be given in needed cases. And if the animal is very much anemic, then you have to go for the blood transfusion. For example, if the animal is very much anemic, it is brought to you, it's a delayed case, and the PCV, packed cell volume, is less than 15, then you have to go for transfusion. More than 15, you can manage it. Okay, manage by medical management, and all slowly it will come up. If it is less than 15, then you have to go for the blood transfusion. And oral antacids can be used. It's very much helpful for healing process. Okay. For example, the aluminum hydroxide, which is available in the market, you can use. For example, you are having the many commercial preparations which are having both aluminum hydroxide and magnesium hydroxide, that we are using as a oral antacid for ruminal acidosis case. You are using, no? The same thing you can use here. Aluminum hydroxide, what is the indication? It absorbs pepsin and decreases the proteolytic activity, and it binds the bile acids to protect from the bile reflex. And also magnesium hydroxide, it binds the bile acids. So oral antacids will help for the healing process of the ulcers very easily. And also you can use magnesium oxide, 0.5 to 1 gram per kg body weight, will be very much useful for healing the abomasal ulcers. You can get this magnesium oxide from chemical shop. Magnesium oxide or magnesium carbonate, you can get it from the chemical shops, and you can give it at the dose of 0.5 to 1 gram per kg body weight, and you can give it, mix it with water, and you can give it. If you are having infusion pump, you can infuse orally. Okay, or you have to drench it without aspiration. And you can in the ethnoveterinary practice, apart from this type of pantoprazole and other oral antacids, you can give orally aloe vera also. Aloe vera can be also given. It's excellent, having excellent healing process of ulcers, abomasal ulcers. You can have the aloe vera and remove that green portion of the aloe vera, and you can take that white portion and you can feed the animal 2 or 3 chips of aloe vera, and the excellent results can be observed. And remove high starch feedstuffs and supplement good quality hay, and balanced minerals can be supplemented. And blood transfusion is a case of severe anemia cases. Okay, so some cases may succumb to anemia, so that you have to monitor the PCV value and you have to treat it accordingly. Okay, so abomasal ulcers, whenever you are coming across your practice, dark tarry colored feces, semi-solid in nature, like this. Sometimes you may be getting across the dung material, semi-solid in nature, which will be dark tarry color in nature, is a clear case of abomasal ulcers. Okay, so immediately treat the animal with the pantoprazole IV and give oral antacids. The animal will get cured in 3 to 5 days. And if the animal is very much anemic, the PCV is less than 15%, then you go for transfusion. If it is not complicated with the peritonitis, the prognosis will be good. Only when it is complicated with the diffuse peritonitis, the prognosis will be unfavorable. So when you come across this type of dark tarry color jelly-like thing, like a jam, like jelly, like raspberry jam, mucus-like, that is a case of intestinal obstruction. You should not confuse with abomasal ulcers and this one. You should not confuse with abomasal ulcers and this one, this intersusception. So in abomasal ulcers, dark tarry colored feces will be there, semi-solid in nature, or dung material will be dark tarry colored in nature. Here, in intestinal obstruction, it will be jelly like in nature. So this is regarding the abomasal ulcers. So we have seen about abomasal displacement and abomasal ulcers, and to some extent we will be coming across abomasal bloat, which is very common in calves, lamb, and kids less than 3 weeks of age. You will be coming across abomasal bloat when they are fed with the excess amount of milk, and because some uncertain etiology also will lead to abomasal bloat, and there will be proliferation of Clostridium organism, type of organisms in the abomasal also will lead to abomasal bloat. So here the clinical signs are related to the abdominal distension. In lambs and kids and the calf, you will be able to appreciate the abdominal distension and the fluid splashing sound in the flank region, and persistent tympany will be there, bruxism will be there, the animal will be dull and depressed, and dehydration will be there. All these things you think about abomasal bloat. So treatment, regarding the treatment, prevent further access to the milk of this animal, avoid oral drenching of glucose solutions because it will lead to more fermentation, and you can introduce a stomach tube and relieve the gas and administer the fluid therapy. The animal will become normal in case of these conditions. Very few cases you can come across in calves the abomasal bloat. And antibiotics like penicillin or amoxicillin can be given, and mineral oil can be administered with water orally. Mineral oil means liquid paraffinic active. So such a type of small stomach tubes can be used in case of small ruminants like calf, lamb, but kids. You can use this type of this one stomach tubes can be used. These are the small stomach tubes can be used in case of stomach tube intubation in case of calves and sheep. Then regarding very few cases will be coming across abomasal impaction. So the same thing, the complete anorexia will be there, scanty feces will be there, the abdomen will be distended, and the simple logic is that the clinical signs, you will be getting the clinical signs similar to LDA, but there won't be any pink sound in the left side. So that is the thing. Every clinical signs will be same that of LDA, but if you cannot appreciate the pink sounds in the left flank, and the prognosis of the impaction is regarding to the according to the heart rate only we can assess it. And regarding the treatment, the fluid therapy is the main thing. You have to go for the massive fluid therapy, and you can administer 25% of dioctyl sodium sulfosuccinate 150 ml with the mineral oil and warm water 10 liters. You can infuse it orally. If you are having a oral drenching pump like this infusion pump, you can very well drench the electrolyte solutions or any purgative solutions or any medications. You can administer very well easily without getting aspirated. So if you are having this type of infusion pump, it will be very much useful in case of large animal practice, either for oral rehydration or any administration of oral medications also. It will be very much useful in case of large animal practice. So the take-home message is that we have to learn and do the procedure of stomach tube intubation, either in the large animal or in the calf. Stomach tube intubation is a very important clinical procedure which will be helping to identify many number of clinical cases. For example, if you want to identify a case of acidosis, by putting a stomach tube intubation, you can see the rumen content, you can see the pH, you can see the protozoa, you can see the color of the rumen liquor. If it is milky white in nature, watery in nature, it is a clear case of acidosis. If it is frothy in nature, small bubbles are there, it's a clear case of frothy bloat. So stomach tube intubation will be helpful for your diagnosis very easily in case of large animal. And abdominal synthesis. This technique we have to learn, and we have to well versed with this technique to rule out peritonitis case, traumatic reticuloperitonitis, or whatever the cases, LDA, RDA, whatever the thing we are attending, we can verify whether it is complicated with the peritonitis or not. So you have to do the abdominal synthesis, cranial abdominal synthesis, caudal abdominal. Caudal abdominal synthesis means you have to come to the right side and just lift the flap. I'll show the picture. And just above the udder in the right side, we can put the needle, and not in the right side. If we are putting the left side, we will be getting the rumen content. So you have to come to the right side. And the appreciation of the pink sounds. So clinical examination by auscultation and percussion, and appreciating the pink sound either in the left side or right side. So wherever you are getting the pink sound, you are inserting a needle and aspirating the content. That is called the lip tech test. So we have to well verse in these 4 clinical procedures: stomach tube intubation, abdominosynthesis, clinical examination, meaning physical examination of auscultation with the percussion to identify the pink sounds, and the lip tech test. So if we are well versed in these 4, definitely we can able to appreciate our diagnosis of LDA very easily. Okay. So thank you very much for your patient hearing. And regarding the caudal abdominal synthesis, here this is the site of caudal abdominal synthesis. See, in the right side, just you pull the flap like this, and just above the udder here, you can insert the needle, and you can see whether there is any free flow of peritoneal fluid is there. So cranial abdominal synthesis, caudal abdominal synthesis. When you are getting fluid, cranial and caudal also, it is a diffuse peritonitis. When you are getting any localized area, means it's a localized peritonitis. So that you can differentiate very easily. Okay. And I hope this would have cleared your doubt regarding the abomasal disorders. And by doing a clinical examination, I'm sure it knows many cases in the field. Thank you very much.
Thank you,
Some
Dr.
questions and things.
Shivaraman. Thank you, Dr. Shivaraman, for your nice presentation and detail about
Thank you, sir.
the abominable displacement. I have some practical observation in the field. So, Dr. Mizan, may I ask one or two questions and my observation?
Shubha, you can continue. Yes, Shubha, continue. Yes, you can do that.
Yes.
Thank you, Dr. Shivaraman, for your nice
sir.
presentation. We are really grateful to you because we learn a lot regarding abominable displacement. Although it is new in our cases, but I know it 3 or 4 years back. But in Bangladesh, for farm management, we don't habituated to prevent or I don't know the treatment, but we don't have any initiative regarding the abominable displacement prevention. But in 2016, I got two practical cases in the field, especially a very known place for Dr. Mizan. It was in Bhetchi under Keshapur Upazila or Dumuri. I don't know the Bhetchi, the name of Bhetchi, the place where a cow just 7 days after calving shows the symptom reduce cow dung, reduce amount of cow dung, very pest in nature and in appetite as well. And but the cow was feeling very discomfort. That time we discussed with a veterinarian. We have a veterinarian, Dr. Salam. So we go through the internet and learn about this. And we don't know the treatment. But one case we did with the help of local people. The cow was taken to the pond of water and take the cow upside down 2 or 3 times, then lay the cow field, and it was okay. I don't know if the treatment is right or wrong, but this case happened, and same case happened in the another Opuzela, and it was also cured. But I don't know the what percentage of abomajam in terms of other diseases occur in India or your study. I don't know. I want to know the percentage, and is there any ratio in case of the male or female? Because in Bangladesh we are habituated to manage the cow or the male cow for beef fattening. So in this case, the farmer are habituated to use more grain or concentrate feed for the cows and the dairy animal as well. But the case happen more and more in the beef fattening area. So the case may be happen for the male animal or beef fattening area. I don't know. Our honorable director sir, Dr. Farad sir knows better. But it is my conception whether the male animal may be affected or not. Thank you.
Thank you, sir. Thank you. So, a very good question, sir. As you already you told, sometimes the spontaneous recovery of some abominable displacement will recover. Mild displacement will become normal, as you told, when the animal is making to walk or making to swim, or when it is making to roll. In these methods, mild displacement will get automatically recovered. Some cases yes, and after they giving the fluid therapy, the basic concept is that when you are giving a fluid therapy and electrolyte with the fluid therapy, the contraction of abomasum, the abomasal motility will be enhanced, will be started, and naturally it will come down. That will be reduced and bring back to the normal position. It will get improved. Only the thing, if it is not getting regaining of the motility, the distance will be more, then you have to go for the surgical procedures. And as already your questions very involved, it's mostly involved related to the female, I mean the dairy cows, and we get cases in male also because of the high feeding of the grain content occurs in male also because of feeding of high grain content. Yeah. high grain content feeding and low roughage, it may occur in because of the feeding management also, it may occur in male animal also. And also I don't have the exact ratio of percentage. Let me verify and convey it to Mr. regarding the percentage of the cases. And mild cases will respond spontaneously with the fluid therapy and administration of the calcium and with the procedures as you have mentioned.
Thank you.
Yes, sir.
Thank you, sir, for your very logical question, and also I think the answer is also fitted with the specific query. And then we'll request Dr. Rosayan Mansur for your specific questions. Will you please unmute yourself and ask your questions?
Thank you very much, Dr. Siva, for your information. Such a very good lecture on ebom disorders. I mean, at the same time, we would be able to refresh ourselves in terms of the ebom disorders. But I would like to ask you, like, how often you guys do surgical intervention in treating ebom disorders? How often do you opt for surgical intervention? How often do you guys opt for surgical intervention to treat ebom disorders?
How often we are getting cases?
No. How often do you guys go for surgical intervention in treating the ebom disorders, ebom displacement, or
For correction of ebom disorders.
yeah.
Yeah. For initially we are going for the medical management and mild displacement of organism and all, it will get resolved naturally with the administration of the fluid therapy, and as I already told, the calcium therapy and the prokinetic drugs and all, it will get spontaneously recovered. So not recovered cases, if it is not responding medically, then we have to go for the surgical procedures. There are many surgical procedures like abomesopexy and all, and they are doing well, and the response to the treatment depends upon the presentation of the cases. If it is a delayed case and if it is presented with the peritonitis and all, the outcome of the disease will be poor in nature. Otherwise, the outcome of the disease will be good only.
Okay, thank you.
Okay, Dr. Rosayan, do you have any more questions, please? Or
there are some questions in the chat, I think. Here.
Dr. Shubho, I have another question, if you allow.
Yes, sir.
Okay,
yeah, please.
Sure, you can go.
Thank you, Dr. Shubharam. This is Shafiq again. As I have a little interest on genetics, is there any genetical effect if a mother affect on abominable displacement? Very few. And is there any chance to the same case for her daughter or the next generation? Is
No,
there
sir,
any?
not related like that. Yeah, not related.
Okay, thank you.
According to my knowledge, it's not related like that.
Sir, then
there is one question like that from Vivek Chandra.
Yes, sir.
Vivek Chandra. Yeah.
Yes, sir.
How do you choose fluid to correct a severely dehydrated cow with the abominable displacement? Yeah. Because as already told, the biochemical outcome will be like hypochloremia, hypokalemia, and metabolic alkalosis. So you have to go for supplementation of lactated ringer solutions. You can go for electrolyte supplementation with the fluid therapy, ringer lactate solution. You can go for we are having a large animal infusion set. I don't have the picture right in this slide now, otherwise I will show that. Large animal infusion set is there, and within just 2 to 3 minutes you can infuse 1 liter of fluids. That you can use it for this type of cases. You can administer 10 to 15 liters of lactated ringer solutions or electrolyte solutions, so that it will be very much helpful in recovering this type of cases. Rather than using the conventional IV set, you can use the large animal infusion set. So I'll get the picture and I'll send you on. Okay, that type of fluid therapy, we can finish the fluid therapy within 10 to 15 minutes. You can supplement 10 liters of fluids. Okay, and that will be most useful. So you have to monitor the potassium level. The animal may go for hypokalemia, so naturally you have to supplement for potassium. So either you can go for oral supplementation of potassium is safe rather than giving IV. Okay, so you can give oral potassium chloride solution 100 gram, accordingly mix it with some water, and you can infuse it through the infusion pump. And also you can give parenteral fluids, okay, electrolyte solutions.
Okay, thank you, sir. And
Then,
then we'll take.
Can we give oral purgatives with magnesium sulfate in abomesal route? You can give purgatives. You can give purgatives. Which site is better for abdominocentesis, the ventral one or the right ventral flap? Ventral abdomen means it's a cranial abdominocentesis in the ventral abdomen. Caudal abdominocentesis, you can put the right ventral flap. Both the things you can do and verify whether it is localized or diffuse peritonitis. I think that's all the questions.
Okay, sir. Yes, sir. Then we have another question here from Dr. Pasha. How much percent of cases are treated with any medicinal treatment without any surgical intervention? That's a question from Dr. Pasha.
Yeah.
Sir,
I
is
don't know about the
on
exact
the
percentage.
displaced abomasum.
Yeah, regarding the displaced abomasum, I don't have the any present literature with having a percentage like that. So whenever the case is presented earlier and your diagnosis of a displacement earlier, and you can medically manage it, and you can wait for a response with the 24 to 36 hours medically management, and if it is not responding to your medical management, then you can go for surgical. Okay. Regarding the percentage, I don't have the figure, and I'll get back and give the information to Mizam regarding the percentage of the cases. Okay.
Sir, I
Thank
have
you,
another
sir.
question.
Yes.
Shall I, Shubho? Shall I?
Yes, sure.
Okay, sir, I have another question. So, in the connection on the peritonicentesis regarding the cranial abdomen or the caudal one, so shall I go both or choose only one?
You can go for both cranial
Okay,
and caudal. You can do both so that you can verify whether it is a localized peritonitis or diffuse peritonitis. For example, in abomesal ulcers, you can do it in both cranial and caudal, and you can identify whether it is a localized peritonitis or diffuse peritonitis. You can easily identify. And have you come across any case of abomesal ulcers in field conditions? Ulcers.
thank you, sir.
So sir has asked a questions to Pasha if you have experienced any cases with abdominal ulcers. Hello, Dr. Pasha, can you hear?
Yeah, I
Yes.
can hear you. Yes.
Yes. So sir has asked on question if you have any experience with abomasal ulcer case in here during your practicing experience.
Not so much. I haven't seen any in Bangladesh yet. Maybe because of my diagnostic inability or maybe something, but I haven't seen it.
Definitely, you will be coming across near future regarding the abomasal ulcers. Whenever you are getting a case of dark terry color dung, you rule out abomasal ulcers. And within 1 month, you will be telling me, I have diagnosed a case of abomasal ulcer and treated successfully. That will be the success of this program.
I have found tarical feces in case of thylariosis,
Yes.
but not in case of about it in thylariosis.
Okay, thank you, Dr. Pasha, for your supplementation. And then I will go to Dr. Faradoshan, sir, for your questions and queries. Thank you, sir.
Thank you, Dr. Sibaram, for your nice presentation. Although last 5 years I am out of uh, treatment and consultation, but after 1 month later I will start again. In Bangladesh, a number of abomasal displacement disorder cases is there, but in my tenure or in my practicing time, I am not easily understand. I think this may be abomasal displacement disorder is there, but could not diagnosed properly. Um, your presentation, it is clear there are so many cases in Bangladesh, especially crossbreeding animals is there. So it will be very helpful for me for diagnosis abomasal disorder later on. So I also thanks Dr. Sivaram. His nice presentation. And I think we will able to diagnose abomasal disorders and try to correction in future. Thank you, Sivaram, for your nice presentation, and again thanks. Thank you.
Thank you, sir. Thank you, sir. Only the thing I request our veterinarians, once they suspect any case of abomasal displacement, whenever they are coming across a case of reduced quantity of the dung, recently cowed animal, not responding to your routine treatment, immediately you take your stethoscope and do the percussion and auscultation, as already told in the left side or right side, whatever doing, and first identify the ping sound. That is more than enough. That indicates that you have diagnosed a case of abomasal displacement. Then you can do the lip tag test. That's it.
Thank you. Thank you very much.
Thank you, sir.
Thank you so much, sir, for influencing the diagnostic procedures and others very clearly. I think that will help our veterinarians and the new practitioners to apply these methods, and they will definitely will succeed in the treating the cases. So now I'll request to Dr. Mizan sir to introduce your questions to Dr. Shivaram sir.
Thank you very much, Shivaram. I think I don't have a questions. He covered everything very well, very well. So from my side, I have nothing to ask. And what I should say, I want to just thank you, Shivaraman, because we requested you and you took all the procedure because you had to follow some official procedures in India to get the permission for this lecture. I thank you very much to take all the troubles. So, Shubha, from my side, there is no questions, but are there no questions from the audiences? You can ask questions.
So there's one more question here. I see. You have mentioned for the dairy cows, but can abomasal disorders can happen in bull?
Yes, he answered already.
Yes.
In abomasal ulcers, it's very it will come in all the animals, dairy cow, bull, everyone.
Okay, sir. So that's all for now. But we can get more questions in future, and we can forward them. But yes, sir. We have one more question from Dr. Vivek Chandra Sutradhar sir again. What is your suggestion?
What is your suggestion to treat an abomasal perforation with the surgery? Yes. So here there should be a coordination between the physician, clinician, and the surgeon. So once diagnosed, and they can go for correcting the abomasal disorders by surgical corrections, so that we can have a success rate. So the coordination should be there. And regarding the abomasal perforations, as already told, when it is perforated and it is complicated with peritonitis, the outcome of the case will be poor. Otherwise, the prognosis will be good. When it is complicated with the peritonitis, the outcome of the disease will be poor. So that I have told them prognostic indicators like evaluation of the blood lactate level, evaluation of the heart rate. All these things will give us a clue regarding the outcome of the disease. Whenever there is abdominal perforation, sir has asked, Vivek sir has asked another one good question. This type of abdominal perforations may lead to pneumoperitoneum. So that is another one complication, pneumoperitoneum. Okay.
Okay, sir. So we have no more questions from audience, sir, but later we will get more questions, and we can forward the questions to sir for your answers. So
Yes.
I'll request among the panelists if you have any more questions to Dr. Shivaraman, sir.
Yes, a special ask. Yes, Roja and Mansoor, do you have any more questions or anything
No,
to ask to Shivaram? Okay, thank you.
no.
So what we'll do, I think, if nobody, Shivaram, do you want to say something before you leave?
So, Dr. Shivaraman, sir, so will you want to add some concluding sentences before we
It's
leave?
okay. Yeah. I thank Dr. Mizan and his team and Adar Health Bangladesh and Chittagong Veterinary Animal Science University for giving me the opportunity to join the 16th online session. And I also thank our Tanvas University for giving me the permission to join this session. And I congratulate Mizan and his team for their wonderful work and a wonderful job. And I hope after this session, many of our veterinarians can identify the abomasal disorders like abomasal ulcers and abomasal displacement, and soon they will be giving a feedback to you that we have diagnosed abomasal displacement or abomasal ulcers in field conditions successfully like that. So that will be the success of this program. Thank you very much. Thank you.
Thank you so much, sir. Then I'll request to Dr. Mizan, sir, for your concluding remarks.
Yeah, thank you very much. Thank you very much, everybody here, especially Dr. Farad sir. I think he's very busy. He's going to attend 2 more sessions after these lectures, and also Shofikur Rahman, Dr. Shofik, and Dr. Ruzan Mansoor, Dr. Riyad Pasha. And I also take your attention that next month we are going to organize another session with Dr. Shivaraman. He will lecture on small ruminant medicine. And also in near future, we are planning for a lecture on the buffalo management, because we have a project on buffalo is going on. And maybe for the Rosahan Mansoor, this buffalo management session may be useful for you, because you told us that your government has given you a big project on buffalo in Malaysia. So we can invite you in this session. So thank you everybody, especially thanks goes to the Shivaraman for your time, because you have a night long duty in our hospital. Now you have given time for us. So take rest, and thank you very much. Thank you everybody, and
Thank you.
stay safe. See you next time.
Thank
Thank
Thank you.
you.
Thank you.
Thank you.
Thank you,
Thank
Shivaram.
you.